This is Alicia Alt, reporting from the International Stroke Conference in New Orleans. Continuous outpatient cardiac telemetry can play an important role in identifying atrial fibrillation. Dr. Daniel Miller presented data showing that outpatient monitoring for at least 21 days identified AF in patients who might not otherwise get anticoagulated. A review of 156 patients who had monitoring and had a cryptogenic stroke or TIA found that 17% had AF, a known stroke risk factor. 97% were not receiving anticoagulants. AF detection increased with longer duration of monitoring. The greatest detection occurred at 21 days.
There's been many different methods of monitoring that started off with 24 to 48 hours of continuous monitoring. There were versions that went up to 7 days. And then our study does show that in order to capture all these events, you should continue to monitor for at least 21 days. We don't have data beyond that, so a minimum of 21 days would be what we would recommend monitoring with this device.
Dr. Miller said it was important to identify these patients so they could receive appropriate prevention therapy.
So atrial fibrillation in the setting of a prior stroke or TIA carries a very high recurrent stroke rate if untreated. So patients with a prior stroke or TIA and atrial fibrillation carry approximately 10% per year risk of a recurrent stroke on aspirin alone. But when you put them on specialized treatment, the anticoagulation with warfarin or one of the newer agents, you decrease that risk to between 2 and 5% per year.
I asked Dr. Miller whether these devices are widely available and easy to use.
I believe so. It is fairly available wherever you go, and I'm sure they would be happy to make it available. It is actually mailed to the patient directly, so it could probably be mailed from just about anywhere.